Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we are going to be talking about Hydrofera Blue Classic. But first, if you could hit that like and subscribe, it would be greatly appreciated as it does help my channel grow. So let's get started. So Hydrofera Blue Classic is an absorbent polyvinyl alcohol foam. It does contain methylene blue and gentian violet, which does provide a broad spectrum antibacterial. The PVA foam is dry, firm dressing sheet, so it needs to be moistened before use. And the foam is not to be allowed to dry out, or it does go back to that hard dressing sheet, which will cause pressure. And you don't want that because it'll almost cause like a pressure ulcer in a wound. And you can use this with enzymatic debridement or growth factors. So this product is for wounds and of moderate to large amounts of exudate because it does absorb a lot of exudate, and it is also for first and second degree burns. All these wounds with signs and symptoms of infection, because you need to remember that we always want to be using antibacterials, antimicrobials for wounds with infections. So that's going over your nerds and stonies to determine if there is an infection. If there's an infection, we would want to use a product like this because it does have that antimicrobial effect. Now, Precautions, we're not going to allow this to dry out because, like I said before, it will go back into its hard form. That's why we want to make sure that we're using it with moderate to large amounts of exudate. If you're going to use this for an extended period of time, after 6 months, there should be a clinical review of the product. This dressing has not been tested on pregnant or breastfeeding women. And contraindications, we're not going to be using this on patients who have allergies or sensitivities to any of the ingredients, and we're also not going to use this on third-degree burns. So to apply this dressing, we are just going to first start by cleansing and irrigating the wound. You can dry the peri-wound. You can cut this dressing to fit inside the wound bed as needed. You're going to moisten the dressing with sterile saline or sterile water. You're going to squeeze it out with either your forceps or your sterile glove. You're going to apply the dressing to the wound base, making sure it fills up any dead space because that's how our wound grows towards the dressing to fill up that dead space. And then you're just going to apply a cover dressing to maintain an appropriate moist wound. So the Hydrofera Blue Classic, it does come in either the squares like you just seen, or it does come in the tunnel tubes, okay? So these are the tunnel tubes down here, as you can see. And you're going to do the same thing. You're going to cleanse the wound. You're going to moisten one end of the tube, and it'll just kind of, you'll watch it. It'll soak the water all the way down. You're going to squeeze out any excess. And then you're going to just gently pack the tunnel, okay? So you want to make sure if the tunnel, if you're packing it in, it shouldn't be tight. It should just be loosely fit in there, okay? And then you're going to allow for at least a 2-centimeter tail for the wound cavity so it can be pulled out easy. And then you're going to want to make sure that you just moisten with a few drops the end, so that 2-centimeter tail. Just add a couple drops of sterile saline or sterile water to that just before applying the cover dressing. And just make sure that the cover dressing is appropriate for to maintain a moisture balanced wound. Okay, so we also have the Ostomy Ring. So once again, you're going to cleanse the wound, the peristomal skin, and then you're going to pat that dry. you're going to cut the ostomy ring to fit around the ostomy. Okay, so as you can see here, you're going to fit it in here. So the shiny side, so place the film shiny side of the ring onto the appliance, okay? And you're going to smooth it into place, and then you're just going to apply it as per usual. So this is not moistened before it is applied. Okay, so to remove this, you're going to just gently remove it with the forceps. If it's sticking, you're just going to hydrate it with some more sterile water or sterile saline. Just let it sit there for a few minutes and then gently remove. Okay, that's with any dressing. If it ever sticks, just add some saline or sterile water and it will come off. Now, the frequency of dressing change, it is going to depend on the amount of exudate coming out of the wound. So it does have a color change indicator. So it starts off as blue and it turns to white. So you're going to monitor for the first little while how long it takes to lighten the blue color or turn white. Okay, so if you're noticing that it's white, it needs to be changed. If it's starting to lighten in color, and is quite light and it's going almost to white, you're going to replace it, okay? And then that's how you're going to determine the frequency of dressing change, okay? By that color change indicator. It can stay in place for up to 3 days. And for ostomies, you're just going to change it as needed. The expected outcome of using this is that you have no peri-wound maceration and signs and symptoms of local infection are resolved within 2 weeks. So that's all I have for this video. If you haven't done so already, please hit that subscribe button, as it does really truly help my channel grow, and I am trying to grow this channel and help as many healthcare professionals as I can with all these wound care products. So that's all I have, and I hope to catch you in my next video. See you guys.